Hi, my name is Lakshmi. I'm a infant student at Xavier. Can you tell me your name and date of birth?
Hi, I'm Kagendra Rizal, 5/10/1994.
Perfect. And today I'll be performing annual assessments on you. I will begin with questions and then I'll do the actual physical examination, okay?
Okay, sounds good.
Alrighty. Any fevers or chills?
No,
Any eye sensitivity or dryness from your eyes?
no,
Any bleeding from your gum? Problem with your teeth, sore throat?
no,
Any neck pain, neck stiffness?
no,
Okay. Do you feel like your heart is skipping a bit at times? Any swellings in your legs?
no,
Any breathing problems like cough or shortness of breath?
no,
Any GI issues like diarrhea, constipation, rectal bleeding?
no,
Any urgency, frequency, burning sensation when you pee?
no,
Any leakage when you pee?
no,
Okay. Any muscle pain, joint pain?
no,
Any headache or any weakness in your arms or legs?
mm-mm,
Any mood changes or sleep disturbances?
no,
Okay. Do you have any significant medical history?
no,
Any surgeries that you've had in the past?
no.
Do you take any medications at home?
No medication, just a multivitamin supplement.
Okay. No over-the-counter medicine or oral supplements?
No, that's it.
Do you have any allergies to any medicine or food?
No.
Okay. Now I'm going to ask you about your family. This includes your siblings, your parents, and your grandparents, okay?
Mm-hmm.
Anyone in the family that you know of have diabetes, high cholesterol, hypertension, or high blood pressure?
Mom has diabetes, dad has diabetes and high cholesterol. Siblings do not have anything. And I do not know anything about my grandparents. They passed away like in their late 80s.
What side?
Both sides of the
Okay.
family, yes.
Okay. How many siblings?
One sibling,
One old brother or sister?
younger brother.
Younger brother? No history. Okay.
No.
And how old are your parents?
Mom is 72, dad is 74.
Okay, okay. And now I'm going to ask you about your social history, okay? Do you drink any alcohol?
No.
Do you smoke any tobacco or any marijuana use, cannabis use? Do you vape?
No.
Okay. And what is your education level?
Bachelor's degree?
Do you work?
Full time, yes.
Yes, okay. And what is your marital status?
Married.
Okay. Who do you live with?
My wife.
Okay. Do you exercise?
2 to 3 times a week for an hour-ish.
Do you drink any coffee?
A little bit of coffee, yeah.
Okay.
About a cup.
A day?
Yeah.
Okay. And what does your diet look like on a normal day?
Pretty good. I'd say breakfast, I have eggs and a toast, and lunch chicken and rice. And for dinner, it's mostly veggies and another source of protein.
Okay, alrighty. Perfect. Next I'm going to actually start with your actual assessment. So we're going to start from your skin. Skin is warm to touch, no rashes or any lesions on your skin. Your hair has normal texture. Palpating your head and no lumps or bumps. Your face is symmetric. Trachea is midline. Alright, next I'm going to go ahead and palpate your thyroid here.
Okay.
Go ahead and swallow for me. I can feel the movement of the up and down of the thyroid, which is good. No, go ahead and tuck your chin for me so I can check your cervical line here. I can see the prominent C7. Any pain, tenderness here?
No.
No? Okay. Next, I'm going to go ahead and palpate your TMJ.
Mm-hmm.
Go ahead and open and close your mouth for me. I didn't feel any clicking, which is good. Next, I'm going to palpate your temporal and your masseter bone, which is cranial nerve 5, okay?
Okay.
And go ahead and cleanse your teeth. Any pain, tenderness here?
No.
No, okay. Next, I'm going to palpate your lymph nodes, starting with preauricular. Let me know if you feel any tenderness.
No.
Preauricular, postauricular, tonsillar, submandibular, submental, anterior cervical, posterior cervical, and the occipital. No pain, no tenderness there?
No.
No? Okay. Next, I'm going to go ahead and inspect your eyes. There's no crossings or any dryness around your eyes, eyebrows, or eyelashes. I'm going to go ahead and check your conjunctiva. It is pink, and no dryness, no signs of jaundice. Sclera is white, no signs of jaundice there as well. I'm going to use my light to inspect your pupils to see if they are equal and reactive to light. Right pupil constricted to light, it's about 2. Let pupil also constricted to light is also about to. So both of your pupils are equal and reactive to light, which is cranial nerve 3, 4, and 6 is intact. Next, I'm going to check your extraocular movements and the convergence test, which is also, again, checking for cranial nerve 3, 4, and 6, okay? I'm going to move my finger in cardinal fields, and I just need you to follow my finger. Keep looking at my finger, and I can see that your pupil constricted, which is good. Next, I'm going to go ahead and perform visual field test, which is checking for your cranial nerve 2. I'm going to wiggle my fingers, and I just need you to tell me when you're able to see them.
No.
Okay.
No.
All right. Cranial nerve is also intact. Perfect. Now I'm going to go ahead and perform cover and cover test. So I'm going to cover your left eye here and look if there's any extra movements in the right eye, which I don't see any. No extra movements of your left eye when I cover the right eye, which is good. Now I'm going to go ahead and inspect your eyes. Right now, arteries vein into my ophthalmoscope here. Retinal reflex is present, and following that, I can see the artery, which is thinner, wider vein. Disc and cup, the risk is 1:2. There's no exudates or any signs of papilledema. Red reflex presence. Following that, I can see the thinner arteries, wider vein, disc and cup. The risk is 1:2. No exudates, no hemorrhoids, anything like that. Good. Okay, next I'm gonna go ahead and ask you to perform range of motion of your neck. Okay, go ahead and fix your chin. Flexion, extension, go ahead and look up your ceiling, move it side to side. Lateral, go ahead and look up your shoulder. The other side, rotation is good. Now I'm going to go ahead and check your cranial nerve 7, okay? So go ahead and smile for me. Raise your eyebrows. Puff your cheek out. Alrighty, perfect. Your cranial nerve 7 is also intact. Now I'm going to go ahead and just inspect your auricles. There's no signs of inflammation, no dryness. I'm going to go ahead and palpate them. Let me know if you feel any tenderness around your auricle.
No.
And mastoid bone?
No.
Okay. Now I'm going to go ahead and check your cranial nerve 8, which is the acoustic. So I'm going to go ahead and perform whisper test. First, I'm going to close this ear and I'm going to say a word. And I need you to say that word back, okay?
Apple. Apple.
Alright, perfect. Now I'm going to perform Weber test. So I'm going to put this tuning fork over your head and let me know if you hear it equally or more on one or the other, okay? Do you hear it equally in both ears or more on or less on one or the other?
Equally in both.
Perfect. So that means there was no lateralization. There's no signs of a conductive or sensory hearing loss. Now I'm going to go ahead and perform Ryan test. I'll put it on your mastoid bone. Let me know when you stop hearing it.
No.
Okay. Can you hear it again?
Yes.
Perfect. We'll do the same on the other ear. Let me know when you stop hearing it.
No.
Can you still hear it?
Yes.
Perfect. So which means your air conduction was greater or shorter than wind conduction, which is normal or negative when I test, okay? Now I'm going to use my source of light to take a look into your ears, starting with your right ear. Alrighty. The tympanic bone or tympanic membrane is visible. There's no dryness, no serum impaction. The cone of light is also visible, and malleus is also visible. Just look good. Now I'm going to go ahead and inspect your left ear. The tympanic membrane is visible. It is not bulging nor serum infection. I can see the cone of light and the malleus also. Good. Alright. Next I'm going to just inspecting your nose, which is symmetric. I'm going to go ahead and just palpate it. Any tenderness? I'm going to occlude both of your ears to check your patency one at a time. Go ahead and take a deep breath. Take a deep breath. Okay, both of your ears are patent. Next I'm going to ask you to close your eyes, and I'm going to go ahead and let's just smell something here and tell me what kind of scent it is.
Rosemary?
That's right. Close your eyes again. Can you tell me what you can smell?
Smells like coffee beans.
That's right. Your cranial nerve 1 is also intact, which is good. And now I'm going to use my light to inspect your nose. Turn up a little. The tympanic membrane's pink and the septum is midline, which is good. Now I'm going to go ahead and just checking your lips. It is pink and moist. Now I'm going to ask you to open your mouth for me so I can take a look into your mouth.
Okay.
Open. Alright, good dentition, no bleeding around the gum, and the uvula is midline, tonsils are not enlarged. Go ahead and say out for me. And I can see the movement of the up and down movement of the uvula when you say out, which means normal cranial of 9 and 10. Now I'm going to use this to take a look of, inspect your tongue. Go ahead and stick your tongue out for me. Tongue is midline, which means normal cranial nerve 12. I'm just checking for any white or red patches, which I don't see any, which is good. Alright, perfect. Next we're going to move on to the respiratory exam. So I'm going to go ahead and just lower your gown here a little to see your chest movement. I can see that you're not using any extra muscles to breathe, which is good. I'm going to go ahead and perform your chest expansion. Can you get up the side a little bit?
Okay.
And tilt a little bit?
This one?
So yeah, the camera can see the back here.
Okay.
Perfect. Alright. So I'm just checking your chest expansion. When it's a deep breath. Alright, and my hand move up and down when you take a deep breath, which is good. Next, I'm going to go ahead and just lightly palpate your chest here, chest wall. Any pain, any tenderness?
No.
I'm not feeling any crepitus, no pain. Good. Now I'm going to go ahead and perform tactile femoris. Come back a little. Okay, that is good.
That's good. Okay.
Or maybe just tilt it a little bit.
A little bit. This
Yeah,
one?
so we can see both sides. Alright,
Alright.
perfect. Go ahead and say 99.
99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99.
I can feel the vibration throughout your chest, throughout your lungs, so that means there's no signs of any consolidations or anything, which is good.
Alright.
Next, I'm going to go ahead and percuss your lung sounds, starting from here, and tympanic throughout. Okay, just going to go ahead and press behind, posterior chest. Okay, and it's also tympanic throughout. Next, I'm going to go ahead and perform diaphragmatic excursion. Give me a leg just right there.
Okay.
I'm just checking the from the inferior tip of the scapula right here. Go ahead and take a deep breath and hold. Okay, I can hear tones right here. Now you can exhale, take a deep breath, blow out, and hold again. Okay, tympanic. Alright, I can hear tones right there. And now it should be 3 centimeters. Or less than 3, which is actually 3 centimeters, so that is good. Good diaphragmatic excursion. Now I'm going to go ahead and listen to your lung sounds. Just take deep breaths for me. Lung sounds clear. I don't hear any wheezing or any freckles. Deep breaths. Alright, good. All lung sounds are clear. Now I'm going to go ahead and perform a diaphragm chest. So I'm going to ask you to say E whenever you feel the stethoscope touch your chest, okay?
Okay.
Go ahead and say E.
E, 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 E.
Perfect. I heard E when you said E, so that means there's no consolidations or any air or fluids trapped there. Okay, good, perfect. That concludes our respiratory exam. Next, I'm going to go ahead and perform cardiovascular exam on you. So I'm going to ask you to lay on your back for me here, and I'm going to raise the head at about 30-degree angle. Alright. Okay, go ahead and tilt your head towards the left side a little bit for me. And I'm just inspecting the jugular vein. I know it is not distended, I can see, but I'm going to go ahead and measure it. And at 30-degree angle, it should be less than 3 centimeters. So I can see the sternocleidomastoid bone right there. And it is about 1.5 centimeter, which is good. Now I'm just going to go ahead and palpate your parietal pulses, one at a time. I don't feel any thrill. No feels on either side. Next, I'm going to go ahead and just listen to the parietal pulses. I don't hear any bruit. It is upstroke. Alright, no signs of bruit, upstroke throughout, which is good. Next, I'm going to go ahead and palpate your impulse sites, okay? Starting from the aorta, which is the second intercostal space right in sternal border. Second intercostal space left sternal border is the pulmonic. The Erb's point is the third intercostal space left sternal border. Tricuspid is fourth intercostal space left sternal border. And the mitral valve is the fifth intercostal space mid-clavicular line. No tenderness, I didn't feel any crevitus, which is good. Now I'm going to go ahead and listen to those sites, starting from the aorta. Normal cardiac sounds, pulmonic, Erb's point, tricuspid, and the mitral valve. I didn't hear any extra murmurs or any extra sounds, which is good. And next I'm going to go ahead and palpate your pulses. A strong radial pulse, +2, equal both sides bilaterally, +2 brachial pulses bilaterally, and your lower extremity is also warm to touch. There's no signs of varicositis, no edema. Nice and shiny. I'm going to go ahead and check for capillary refills, less than 2 seconds. And I'm just going ahead and checking for your dorsalis pedal pulse, +2 bilaterally, which is good. And I'm going to go ahead and check for capillary refills. This is also less than 2 on your upper extremity as well. Alright, good. Next I'm going to go ahead and perform Allen test on your hand here. So I'm going to ask you to make a fist a couple times and then let go. Okay, I am including both your radial and your ulnar pulses right now, and I can see your hand turned pale, but I'm going to uninclude the radial side, and now the color turned to pink, which means now there's normal circulation. And let's do the same one more time. Okay, you can let go. And it turned pale when I included both pulses, but this time I'm going to uninclude the ulnar side, and the color turned back to pink, which means there's normal circulation. Alright, so we're done with the cardiac. Next we're going to move on to the abdomen. So I'm just inspecting the contour of your abdomen. There's no signs of bulging or any hernias, which is good. Now I'm going to go ahead and auscultate. Starting from right lower, normal bowel sound present, right upper, left upper, I can hear the bowel sounds, left lower. So bowel sound presence in all quadrants, which is good. Next I'm going to go ahead and percuss your bowel sounds here, okay, or the landmarks. Starting from right lower, tympanic throughout, left upper, left lower, good. Now I'm going to go ahead and measure the, or percuss your liver span. So starting right over here, you can rest your head down.
Okay.
Just from here. I'm going to listen for the change of the sound from tympanic to dullness. Alright, which is right there. And now I'm going to move from the rib cage here to the until I hear tympanic again, which is right there. And that should be about 4 to 7 centimeters. And yours is about 5 centimeters, so which is good. Alright, and now I'm going to go ahead and lightly palpate your abdomen. Let me know if you feel any tenderness, starting from right lower, right upper, no tenderness, no pain?
No.
Okay, right, left upper, left lower. Now I'm going to deeply palpate your belly. Any pain, tenderness here?
No.
Any pain?
No.
Any pain here?
No.
Any pain here?
No.
Okay, now I'm going to perform a test called rebound tenderness. So you let me know if you feel pain, which is worse when I press down or when I let go, okay? Any pain, anytime?
No.
So that means negative rebound tenderness. Now I'm going to perform Rossing sign. So I'm going to press on your left upper quadrant here and let me know if you feel any pain on the right upper quadrant.
No.
No? Okay. Now I'm going to ask you to take a deep breath and hold for me while I press on your belly again. Okay, you didn't stop holding your breath, which means you didn't have any pain when I pressed down, so that is negative Murphy's sign. And then next I'm going to also auscultate your aorta, the renal artery, and the iliac artery. Okay, normal sounds there. And now I'm going to ask you to sit up and on the side of the bed, a little bit sideways so we can measure your CBA tenderness.
Does this work?
Yes, that works. Just gonna put my hand right here, and I'm going to make a fist and hit against my hand. Let me know if you feel any pain.
No.
Any pain? No. Alrighty. Next, we're gonna move on to the musculoskeletal exam. So
Alright.
I'll be checking your joints, and we'll also be performing your range of motions. Okay?
Okay.
Alrighty. So I'm going to start from your wrist or your fingers here. I didn't see any swollen joints, no swollen joints around finger or the wrist, which is good. Now go ahead and flex your fingers and extend. Put your fingers away, abduction, and put them together, abduction, good. Now I'm going to go ahead and inspect or palpate your olecranon fossa on your elbow. Any pain, tenderness?
No.
Flex your elbows and extend. Any pain, tenderness?
No.
Now I'm going to ask you to stand up for me so I can check the symmetry of your shoulder. Turn around. And your shoulder is symmetric. Any pain, tenderness here?
No.
No? Okay. Alrighty. Now we're going to go ahead and perform range of motion of your shoulder. So I'm going to ask you to flex and extend, try and right behind you. Yep. Perfect. Now you can rest, relax your hands, and we're going to do this one at a time. Okay?
Okay.
Go ahead and touch your neck. Internal rotation. Go ahead and touch your opposite scapula. External rotation. Now we're going to do the same with the other hand. You can relax the other hand. Internal rotation. External rotation. Good job. Alrighty. Now I'm going to perform what is called painful arc test. So I'm going to have you put your arms up and around like that. Any pain on your shoulder?
No.
No? Okay, so that means negative painful arc test, which is good. Next, I'm going to inspect your spine. Turn around here. I can see that your curvature is S, which is normal. Any pain, tenderness here?
No.
Alright, try and touch your toes so I can see the alignment. And the spine alignment is also good, midline. No signs of scoliosis. Alright, also, can you go ahead and shrug your shoulders for me? Perfect, that is creating no 12 is normal, which is good. You can relax. Alright. Next, we're going to perform range of motion of your knee and your toes. I'm going to ask you to sit down.
Okay.
Any pain, tenderness here?
No.
Okay, we're going to flex your knee behind you and then extend, good. Flex and extend, good. Alrighty. Put your toes down, plantar flexion, put up towards the sitting, dorsiflexion, wiggle your toes, normal range of motion of your fingers and toes, good. Alright, good job. Next, we're going to move on to the neuro exam. So I'm going to check your orientation. Can you tell me today's date and day?
Today is Monday, April 28th, 2025.
And why are you here today?
To have my physical assessment performed.
Perfect. And who's the current president?
Donald Trump.
Okay, and your orientation is times 4, which is good. And now I'm going to go ahead and check your coordination. So I'm going to put my finger up here, and I need you to touch my finger and your nose back and forth.
Okay.
Okay, normal coordination. Now I'm going to check your rapid arms movement. So I'm going to have you put your palms out like that, up and then down, and try and strike your thigh at the same time. Perfect. That is a normal rapid arms test. Next, I am going to check your gait. So I'm going to ask you to stand up and walk for me so I can check your gait. Okay, normal gait. Now I'm going to ask you to walk from your heel to toes on a straight line. Okay, normal tandem walk. Go ahead and walk on your heels. Okay, now go ahead and walk on your toes. Good job. Now I'm going to go ahead and hold you, and I just need you to hop on your one extremity at a time. Okay, now the other. Good job, that is good. Now I'm going to check your Romberg test. So I'm going to ask you to put your arms out like that, and down, and close your eyes. And your body didn't sway for 30 seconds, which is good. Normal Romberg test, or negative. And keep your arms up like that, close your eyes. I'm going to check your pointer drift, so I'm going to push against your hand. And it should come back to normal, which you did, so that is good. And now I'm going to ask you to sit down, and I will check your strength of your upper and lower extremities, okay? So just go ahead and put your arms out like that. Push against my hands, push against my hands. I'm going to ask you to hold, and try to pull me towards you, okay? Push me away, alrighty. Push against my hands, push against my hands, okay, good. Now, next, I'm going to check your sensation. So I'm going to ask you to identify if it's dull or sharp. This is going to be dull, and this is going to be sharp, okay?
Okay.
Yep, close your eyes just like that. This is sharp or dull.
This is dull. Sharp.
Alright, normal sensation. Now I'm going to check for graphesthesia. I'm going to draw a number on your hand while you close your eyes.
Okay.
Can you identify that number?
8.
Perfect, that is normal graphesthesia. Next I'm going to perform Verdinsky sign, or check for Verdinsky sign. So I'm going to have you lay on your back from me here.
Okay.
Put your arms down. I'm going to lift your head up, and I'm checking if you flex or extend your hip or knees, which you didn't, so that was negative Verdinsky sign, which is good. And so now I'm going to ask you one more time to sit on the side of the bed here so I can check your reflexes, okay?
Alright, sounds good.
We're starting from your brachial radialis.
Okay.
Okay, normal biceps. Normal. Normal triceps. Normal +2 reflex. Patellar. Normal patellar reflex. And Achilles. And normal Achilles reflex as well. And I think that concludes our physical examination. Thank you.
Thank you.